this reducted eyes, the light coming from infinity, they are not focused on the retina. This is uncorrected. So they are focused in front of the retina. They have a very strong and very short focus, the plane distance. So how do we making refocus this light back to the retina? Yes, we are going to using the concave lens. See your glasses. If you have myopia, you can notice in the middle actually is thinner and the peripheral is thicker. So just like this. So how they do the work? If you put the lens in front of here, they will change the light pathway, make it bended. Then after our eyeball, they can refocus on the right plane. So this is how making the corrected focus. So this is we call the concave lens. For example, this is to reduce visions. So that's the way how do we correction the myopia. The factor making the there was a lot of fact making the myopia, but according to the current, even we spend millions of dollars, we still don't know. Someone said is genetic. All right, think about it, very easy. If your parents is a myopia, for example, above 400, your kids is very possible you have the myopia, right? And environment. Why the Hong Kong have more myopia? I think maybe because they have the small place, right? Our kids cannot go outside to play around. They always near the work play a lot of video, right? Maybe our living environment is too narrow. We don't have enough light. So all these things still investigated. If definitely, if you play too much video, if you watch too much TV, you read a lot of book, right? Making your knowledge. The price is you getting the myopias. However, if you go outside, maybe give you some release. So it's good to have your kids to have more outdoor activity. If you don't want them to wear glasses, I think in this model society, this is a little bit hard to achieve because my kids has a lot of homework. Even he's about 3 or 4 years old. So about okay, now we're talking about hyperopia. Hyperopia, another the common language we call that far-sightedness or longer sightedness, opposite to the myopia. They was focused behind. All right. The problem is, of course, is similar, opposite to the myopia. Either refracting power is weak. So because the retina and the lens, they do not have power, make the focus plane behind of the retina, or the eyeball is too short. This is two reasons. And this is the reduction eyes, the infinity lens, the image coming from and by this lens and cornea. They focus not on the retina, but behind the retina. So they have the long focus plane. This is how do we classification of the hyperopia. Contracted to the myopia, they divide by the 4. Myopia has low, moderate, high, and severe. Here, they only have 3, low, moderate, and high. The lower, how do we definitions? Lower than +3. Actually, 0.25 to 2.75, right? If it's 3, that means moderate. So compared to the myopia is what? Minus 2.75. Minus 2.75. So remember, there was number is different when they define low, moderate, and high. In here, moderate is 3.0 to 4.75. Higher is above 4.75. Okay, remember this is a very important different classification of the hyperopia. Myopia has 1, 2, and 3, and 4, plus severe, and their number a little bit different. All right, so in the examinations, please pay attention. Okay, then hyperopia, why is different from the myopia? There was one thing we need to know, because when as a kids, the normal people in some stage, they was have some hyperopia stage. However, some patients they don't show the hyperopia, and that means our eyeball has ability to adjust it. So we call this accommodations. So when we calculation the hyperopia, we making this several idea. I will say before I talking this part, I will let our student know this part must exam, very important. Okay, so this is because our eyeball have ability to adjust it some hyperopia. We call this accommodations. So therefore, they have several hyperopia express method. We call that latent hyperopia, manifest hyperopia, which is divided by absolute hyperopia and facultative hyperopias. And they have another idea called total hyperopia. Total hyperopia is what? Latent plus manifest. So everything including here, we call that total hyperopia. So how do we define that? How do we calculate that? Let's see some definitions. So latent hyperopia, because in the kids, they have more strong self-accommodations. Accommodation means they can adjust it themselves. So they have more ability to adjust it. So there's more in the young kids than in the adult. So they using the accommodations to refocus this hyperopia. And this, how do you show that? You have to using the drug like the atropine to dilate the pupil, relax the muscle, let the eye muscle inside not work. Then they can show up. Okay, we using this drug called cycloplegics, which is atropine. One of the drug normally we use atropine. So this one is not show up, but you have to see this by using the drug to totally relax the muscle. So making their self accommodations ability totally stop. Then they can show up. This one we call the latent, because you have to use a drug to make it show up. All right. Then the hyperopia was compensated by this, can only be fully revealed by the drug. So this is definitions. Manifester have two components. One is facultative. That means, why is facultative? Facultative means false. It's fake, not real. Why is that it's not real? Because this part of the hyperopia, that power, can be corrected by the affected of the accommodation. Remember, these affected accommodations, no need to reveal by the drug. Okay, they have their own ability, save the energy or save the power to adjust it hyperopia. So we call that facultative. Another thing is called absolute. Absolute, that means this part of the hyperopia cannot overcome by patient's own ability. So this part of the absolute hyperopia actually is show up. Even the patients using their own way and own power to making the accommodation, to making an adjustment, but this hyperopia is still there. It's not adjustable. If they are adjustable, they call that facultative. Okay, so this is actually determined by the subjective reflection. Subjective means need our optometrist tested different lens and ask a patient to see if they can see clearly or not. So this part examination, you need collaborations from your patients. So let's making the summary again. So the total hyperopia divided by two parts. One is latent hyperopia, which is you have to show by the drug. This is hiding there, no matter what the patients already have. Another one is the manifester hyperopia, show up. And this show up coming two parts. One is absolute. That means the patients have this and show up. And this facultative hyperopia, that means the patients have the ability to adjust it. Okay? How do we calculate that? So absolute, in the clinical test, actually we just add the length, 25, 25, or 10. Then absolute hyperopia is the minimal. Minimal here, we are talking about the length. The minimal length we use is how much? 25 degree, right? This is the minimal length we can make, or we using in the clinical. So if the patients give you the minimal plus, they can for the clear vision distance. This is hyperopia. Hyperopia. Manifest. Actually, you can patients, you can keep add on. For example, you can on the 25, you can keep putting lens. The patients, they can still see clear image. Why? Because their patients have some ability to adjust it. This hyperopia, they can still accept it. The facultative hyperopia is manifester minus absolute. If you minus this, and this part is how the patients hiding or their own ability have to show the adjustment. And the first part is latent hyperopia, which means you using the drug, then minus this manifester, right? Then this is hiding, which is not show up, but is still coming from patient's adjustment or accommodations. Very complicated. I think a lot of our students have a puzzle, a question mark in your mind. Don't worry. Let's see some example. Let's see some example. We practice two example. Then after tomorrow, I will going to give you the tutor. Let's practice again. I'm pretty sure you will understand. Okay, let's do one by one. Anybody want to take a break? No one? Let's keep moving on. So example one is the distance vision. This patient is 6'6", right? That means this patient looks like it's normal, right? 6'6" actually is pretty good. So it's normal. So what is the absolute? Uh, let's talking about that later. Then